come across tonsillectomy question. And remember, I said best is prone position, but keep that in mind. If you don't have prone position, sideline position, but you're not going semi-Fowlers. Are we clear? Now, if you don't have prone position, you have sideline, that's good. Why? Because the whole thing is preventing aspiration. So if you don't have prone, so remember for tonsillectomy, cleft palate baby, and seizure patient, sideline. The whole thing is you're preventing aspiration. So, but very good. Some of you have done question, came and asked me, you said prone position, but I came across sideline. So remember, if sideline is always good, sideline you don't have, prone position, prone you don't have, go for sideline position, okay? Now, we have done the positioning. I'm going to move on so you guys can go home early and we need to finish. But the main thing, as long as you guys highlight and understand. Cold question, special skills. In special skills, cold application, heat application. Cold and heat application, do you think you need a doctor's order? Yes, we need a doctor's order. So you don't do anything without the physician order. What do you look in your orders? Where are you going to apply? How long are you going to apply? Who is going to monitor your patient? What do you assess here? The skin assessment. And what is cold does? Vasoconstrictor. It's constrict. And what do we use cold here? Is constricting and stopping the bleeding. So a lot of time ice you're applying and cold application for bleeding, bruising area you can apply. Itching question, remember I said someone is complaining under the cast itching, what do you go? Blow dryer I said, or applying the cold. So you got to remember where would you be cold you are going to apply. And what do you monitor here? So cold, first thing we all should know, vasoconstrictor. And heat is dilator. And when do we apply heat? When you have inflammation, redness, that means improving the circulation. Pain time, you're applying heating. And what does it do? Dilate the blood vessel. What do you monitor here? Is the temperature is important, doctor's order is important, and what do we monitor here? The skin assessment. In your question, patient has a heating pad or patient has ice pack and you are applying an ice pack, patient is 78 years old. Patient is pulling out that pack, ice pack, and what would you do? Number one answer may be sit with the patient, hold the patient hand, apply a restraint. Next answer, open the ice pack and check the skin. What would be the answer? Check the skin. Are we clear? So remember heat and cold, doctor's order, assessment, care plan. What do you write in the care plan? Monitor the skin. Who is going to apply? Licensed person. Who is responsible for application of heat and cold? Your licensed person. So that covers your heat question and cold. Next is infiltration. When IV is not going in the vein, and IV is going in the tissue, underline the word subcutaneous or underline surrounding tissue, and that is called infiltration. You are giving IV question. What do you monitor when you are giving IV? Your patient here is the infiltration. And what is infiltration means is the fluid is seeping into subcutaneous tissue or surrounding the tissue. What would be the sign? Underline the word cold. Infiltration is not going to be warm. Infiltration is cold and at their swelling. There will be swelling, hand looks swollen. But when you touch, there is a cold and pain. So patient may have pain, patient has cold. Cold is sign of infiltration. What do? You stop the IV. And where do you start on the other side? Next line, phlebitis. On phlebitis is infection. Phlebitis comes from unsterile technique. And the next line, solution are too heavy. High concentrated solution. And when you have phlebitis, what are you monitoring for phlebitis? Underline the word erythema, redness, pain, drainage. Whenever you have redness and swelling, that's going to be phlebitis. And what would you, phlebitis, you will do same thing. You stop IV, and maybe you need to answer maybe sterile technique, because phlebitis comes from what? Unsterile technique. So sterile technique. Maybe using a filter, because some solution are very strong and they damage the IV, like chemotherapy. A lot of chemotherapy can lead to phlebitis. So they have to use, when they're giving IV, they have to use a special filter to filter through some of the chemicals. So everyone is okay? Infiltration, the fluid. Phlebitis means inflammation. Both of them we got to stop. Both of them you have to start IV on another side. Now in the last line is IV pump is beeping. What do you do? Remember, I said IV, PPN, you do not stop. What do you check? Position, check for king, but don't pick up the answer to stop. Only your tube feeding. If you're giving NG tube and G tube feeding, your pump is beeping, then you stop the pump. But what do you not stop the pump? For your IV and TPN. Call your RN. But what can you check? The position and check for king. Blood transfusion question R. Is 2 nurses is important to check before you give the blood transfusion. If the and why? To check the correct patient, correct type of blood you're giving. So we must verify. Can be RN. Blood is given by RN. You can be LVN to verify the blood. And second line, if there is a bubble. If it's a purple color, that's not good, and it is contaminated, send it back to the lab, to the blood bank. And reaction. What are the signs of reaction? Chill, fever, back pain. Why back pain? Damaging the kidney. So back pain. And also, what do you monitor? Hypotension, they're going into shock. What do you do? Patient has blood transfusion, stop the transfusion. Keep the vein open. And what fluid do you give them is normal saline. You give them normal saline. And so hemolytic reaction can be also later, but immediately your patient has, and you change the IV tubing, remove the bag, and definitely you need to check the IV tubing, and you start with normal saline. And where do you send back the blood? Is to the blood bank and the tubing. Call the doctor and notify, continue monitoring your patient. Now, I'm going to go on oral hygiene question. Now, oral hygiene is, if you have unconscious patient, I want you to add one word on the top, the word is SORDS. S-O-R-D-E-S. When the mouth and the phlegms are very dry, what is the purpose of giving mouth care? To prevent the SORDS? And a lot of questions. What is SORDS? Words are the dry mucus, what is in the mouth. And the purpose is to cleaning that dryness. And what would you do on oral hygiene unconscious patient for you? Is underline the word Yonker catheter. We all should know Yonker catheter. And Yonker catheter is a thick catheter, and we use it for suction the patient. You have on third line, unconscious patient. In unconscious patient, definitely you do not pick up the swab to clean. You always see the swabs, you're using it, but the toothbrush is the one we are going to use it to clean the mouth, because swab is not a oral hygiene. So if you pick up your answer, patient is unconscious, how do you clean the mouth? Your answer is swabs, that would be wrong. What do we clean them? With toothbrush. You've got to do a good oral hygiene. And in your answer, what catheter are we going to use here? Is the Yonker catheter. So underline Yonker, underline the toothbrush and sideline position. And keep suctioning in between. Next is condom catheter. What is a condom catheter? Is external catheter, which is used for male patient. And their question may be, you have a patient who has external catheter. How do you give peri-care? Your answer is remove the condom catheter daily, once a day, not every shift, once daily, and wash the area with soap and water and apply a new catheter. So everyone should know condom catheter. What is the purpose of using condom catheter are to keep the patient dry. It doesn't help to empty the bladder, but you're using for patient who's incontinent and keeping them dry. So what is condom catheter? External catheter. And what does it happen when patient pee? The urine is draining in the bag. You're not putting inside to empty the bladder. And cleaning is important to prevent UTI. And questions are peri-care. All your patient has a catheter. The word is, how do you do the peri-care? Washing with soap and water. Same thing here. Condom catheter, how do we area? Make sure we are cleaning, preventing infection. Triple lumen catheter. I said, where do we use triple lumen catheter? Continuous irrigation. Write down the word is TUR. TUR patient, transurethral resection of the bladder. And for the prostate enlargement. And write down the word CBI, continuous bladder irrigation. And I said already earlier that one to inflate the bulb, and one for urine, and one for irrigation solution. And what is the purpose putting it down this catheter? To prevent your patient from bleeding. And I said earlier, patient who's coming back after surgery and patient is bleeding, what would you do for your question? Don't call the doctor. Check the order for irrigation. Patient already coming back with the catheter. Indwelling catheter is your Foley catheter. And when you're putting a catheter in older patient, underline that. What is the position to insert in older patient? Turn them on the side. Lateral position. Why? Usually you put the patient on recumbent position, you open the leg, but what happened older patient? They're very contracted, a lot of them. And so when they're contracted, you won't be able to open them. So the best position is what position? Turn them on the side, lateral position. So please write down, highlight that word, lateral position. Size of catheters are 14 and 16 catheter. And lateral position only for your geriatric patient, older patient when there is a question. You are not going in recumbent position. You will go on lateral position. Ambulation. You have a patient who has a catheter. Can the patient walk with the catheter? Can they walk? Can they ambulate? Yes. If they give you a question, patient has ambulation, question on that, and patient has a catheter. What you will give them? Shower, you give them tub bath, or a bed bath. You can give them shower. I'll tell you, believe me or not, people do not pick up the right answer here. So every little wording, what I'm telling you, highlight that and pay attention on that, because your questions are, we all see patients are ambulating. Then why don't we put answer to give them shower? You can give them shower, there's no problem. But remember, when they're ambulating, your back should not be higher. Always your back should be in the lower position. So if you have a question, patient has Foley catheter, your best is what? Give them shower. You're not giving a tub bath. You're not giving a bed bath. You can give them shower. And next is shower is okay. Where do you tie your Foley bag? Is to the bed frame, not to the side rails. Remember that wording. So highlight the word, the bed frame. You will tie that. Taping the catheter is important to prevent injury and applying the traction. Tape the catheter where? In the inner aspect of thigh. Allow the movement about 6 to 7 inches. And insert that, how far you're inserting in male catheter, 6 to 7 inches. Highlight that word. And if there is a question, you insert it 6 to 7 inches. The urine is coming out. What do you do when the urine is coming out? You insert some more catheter. Why? Why do we insert some more? Because it's not in the bladder. Where is it? In the urethra. So what happens if you inflate the bulb? It's going to cause a lot of pain. And when there is a pain, and it will be affecting the urethra. So what do? You insert some more and let it go further in your answer. So everyone highlight the word 6 to 7, insert 1 to 1.5 inch. Then you inflate and you insert the water in the catheter. What position is good for putting a male patient the catheter? Supine position. And you do not fold the leg. The legs are more straight, and you hold the penis, and then you insert the catheter. So line 4, wherever you see in your packages, make sure you guys know the positioning. You know how far you're putting the catheter in that. And also, how do you clean before you put the catheter? In circular motion. Clean the meatus in what? Circular motion. How do you clean the catheter? Circular motion. Please, no talking, okay? And take the catheter in female, same way. What position do we have in the female? Dorsal recumbent position. In female, dorsal recumbent, flex the legs and flex the sole of the feet. That means they're bending. And how far do we go? 2 to 4 inches, the catheter. Inserting catheter is if there is no drainage. What do? You are inserting a catheter, maybe question. Patient did not pee and doctor has ordered indwelling catheter. And you are inserting the catheter, there's no urine coming out. What do you do on that? Is leave that catheter in and grab the other catheter. Now, why? Because you are going to put again in the wrong area. So what do? You are inserting catheter. Catheter is not in place. Leave that catheter. Grab the other catheter. And you insert. Once your other catheter is in, then you remove the previous catheter. So you can highlight that. Removing the catheter, we talked already. DC the Foley catheter. Aspirate the fluid. Now remember, even you have says aspirated and you remove that, and it's a clean technique. You wear the regular gloves. Bladder training. Why do we do bladder training? Which questions are you going to pick up this answer? Bladder training for your incontinent patient. Incontinent patient, you want them to become continent, and you're teaching them our bladder training. And what would you be in bladder training? Another answer for incontinent patients are Kegel exercise. And what is Kegel exercise? Strengthening the pelvic floor muscle. What are the muscles are called? Pubococcygeal muscle. What are those muscles are called? Pubococcygeal muscle. So underline that. And how long do you tell them to contract and relax? 10 seconds. And 10 times they will do contraction and relaxation. Next is Creed method. What is a Creed method? Applying manual pressure without putting a catheter. So Creed method means when you have maybe a question, babies have a spino bifida baby, and baby cannot pass the urine. Without catheter, what do we do? On a Creed method. Page number 72, right on the top, the first line, you will see is the Creed method. So make sure you highlight the word. Our next word, I want you guys to know, the word is maturation. What is the word maturation? Patient is not able to start peeing. What is your nursing action? A patient is not going to start peeing as a nursing action. They're not asking catheter. What do? Turn on the water. So highlight the word maturation, turn on the water. Enema question. When you are giving enema, what is it important here? Lubricating. And how far do we insert? 3 to 4 inches. What is the length of your enema cans are? 12 to 18 inches. How much fluid can you give? 750 to 1000 ml. What is the temperature here? Body temperature or 105 degree. Underline that. And what are the body temperature? Either you have body temperature or 105. What do you teach patient when you are giving enema? Take a deep breath. and hold it. And position for enema is left lateral. NG2 question. We already talked about check the placement and also NG2. Now when do we do the X-ray? They give you a question and they say, patient, you are inserting NG2. When they're saying the word confirm, how do you confirm the tube is in? Then your answer is X-ray. When you're doing placement, then you aspirate the fluid or you put the air and you're loosening the placement of the tubing. Next line, bolus feeding, I said, is the Fowler's position. When you're giving continuous feeding, we have talked about that, semi-Fowler's position. And what is the pH of the stomach? 4 or less than 4. How much water do you give for your patient when you're flushing? 30 to 50 ml. You can give them without doctor's order, but lot of the time we have the doctor's order. At the end, checking for residual, where it says 100 or more, you clamp it, continue feeding when you have less than 100. So that covers for you. And what is that, where do you keep all the tube feeding formula? Room temperature. TPN, underneath we have TPN. Where do we keep the TPN? In the fridge. And take it out before patient is going to get the feeding, and so it's kept in the fridge. Where do you get TPN? From the pharmacy. Pharmacists prepare the TPN, and it must be given by RN. And what do we have here is the word is central line. What do they have here? Central line. And what is the purpose of central line? What are the purpose of the central line? Yes. Why do we have what are the things you can go through the central line? You can give nutrition, TPN. I want you to add there, central line, you can give fluids, you can give medication. So fluid, medication, and they can also draw the blood because it's inside the arteries and the veins. So they can go, it's right. And where do you see the central line? Near the clavicle area. So we all should know clavicle area. What do you monitor for TPN? Very simple thing we all should know. What is TPN? TPN is a food. You are giving food to your patient. And which patient do you think you're going to give TPN? If they give you a question, patient had a stroke and patient cannot swallow. I will write down here. And if you have a question, patient has a stroke, patient cannot swallow, how would you feed your patient? You have here IV, you have NG, you have G2, you have TPN. What answer would you pick up here? Patient is not able to swallow. This is all feeding. What answer you will pick up here? Patient cannot swallow. How would you feed your patient? These are your answers here. And you have to pick up one. Which one you will go? TPN? Some said G2. Okay. Let me tell you, you do not pick up TPN. TPN is very invasive procedure. It's going in the heart. When do we give this TPN? Whenever you have problem with absorption. Patient has pancreatitis. Patient has liver problem. Patient has colon problem. The problem is absorption. Are we clear? You don't want to flare that problem. But you can take care of patient who's having a swallowing by putting, so let me say, so you do not put TPN. Why? It's more invasive procedure. And you haven't tried any simple measure, so you don't want to go on TPN. So what would be, do you think IV is giving you food? No. Longer time you cannot feed with IV. It's okay for dehydration, you can give them. But patient is not going to swallow for longer time. So IV, you will not take it. G-tube, you will not take it because it's a surgery. So what is the choice best is? NG2. See how your questions are? We got to know why and the reasons are. So everyone should know TPN is invasive, has a central line. If they ask you what do you give through the central line, you can give the medication, you can give IV, you can give fluid, you can draw the blood. That answer you can pick up. Now what do you monitor when your patient is on TPN? What do we monitor? Anybody knows? What do you monitor? Sugar, very good. What else do we monitor when your patient is on TPN? Sugar, very good. We are monitoring patient with sugar. So if they ask you, you have a patient, and what is the full word is for TPN? Total parental nutrition. And patient is on total parental nutrition, your pump is beeping. Don't turn it off. Again, who will check this? RN. And what would you do when your patient is on TPN? TPN increases the blood sugar. So we all are monitoring the blood sugar. Second thing, TPN is food. Patient wasn't able to take and absorb that food. Aren't you going to monitor the weight? Yes. So number 2, I want to remember, how do you know your TPN is effective? Meaning is working good for your patient. How do you know TPN is effective? Patient is gaining weight. If patient is losing weight, they got to readjust the TPN. Question, what do you notify when your patient is on TPN? Do not pick up the answer with blood sugar. What do we notify here when patient is on TPN? Infection. Why? Because it's central line. So underline the word, or right at this, you don't have in your note, is infection. What is the sign of infection? Maybe white blood count is high, and you've got to monitor for infection. So that covers a little bit on TPN question. Is NG tube question, we said TPN. How do you check your NG tube, how you are inserting NG tube? We all should know from ear to xiphoid process, and neck should be extended first when you're inserting. When you pass through, underline the word oropharyngeal. Then what do you tell the patient here? Flex the neck. That means bend forward. So that may be your question. Now you're inserting NG tube, and your tube is oropharyngeal. What do you tell the patient is to bend the neck or flex the neck. Now I will move on a little bit on specimen collection. You guys, I will highlight the main wording. Urine specimen collection is midstream urine specimen. You are doing for culture. Midstream urine specimen is clean the meatus, number 1. And then you tell the patient to do it in the middle. If you're collecting Foley catheter, clean the port of the catheter. And catheter port collection, you clamp it, that is Foley catheter. So if you have a question midstream, remember the first thing is cleaning, then you're instructing how to collect the specimen. A patient has Foley catheter, you're cleaning the port of the catheter. And how much urine do we really need it? About 10 to 15 ml, 5 to 10 ml is okay. 24 hours collection. In 24 hours collection is number 1, have the sign, container from the lab is important. Discard the first specimen and keep the specimen in the ice. That's important. Stool examination. I want you to add there, guaiac stool specimen. If you have a question, guaiac stool specimen, no vitamin C, no cantaloupe, no turnip, no red meat. It affects the reading of your specimen. Second one is occult blood, hidden blood you're doing, hemoccult blood you're doing. And next is for patient is guaiac stool you have, and we already said that, and the fresh and warm stool for underline the word ova and parasite. That means immediate, second line, ova and parasite, send the stool specimen right to the lab. Next is sputum specimen. In sputum specimen is the position. You can collect by suction, You can ask the patient to expectorate. Position is semifowlers. What is the first best time to collect the sputum specimen? Early morning. And also if you're doing suction, oxygenate is good. Then you skip few lines and you will go on where it says is take a 3 breath. Instruct the patient on the 4th or the 5th line, just in the last 2 lines. And tell the patient to cough and spit and frothy sputum. If you have a question, patient spitted and the sputum is frothy, what do? Discard. That's not a specimen. What do you teach patient before you do it? Tell them to take a deep breath. So underline that, take a 3 deep breath or deep breath. And also you can say cough and expectorate. Breathing, coughing, expectoration are the good wording. And what do you do after you finish collecting specimen? Oral hygiene, mouth care. And then what do? We send immediately. If you're not sending immediately, put them in the fridge. And you use the biohazards container. Wound culture. There are wound cultures are aerobic. Aerobic means superficial wound. That means exposed to air. Within the cavity, anaerobic. And aerobic, you go and take a sterile swabs, both of them, and you clean the wound, get both the collection and put in that little container, or you do have the special tube and you put it in. And there's a place you have to squeeze that so the chemical can keep the tubing moisturized. The next one on the same page is you're doing acute check. How do you do acute check? When do you take the blood? So first thing we all know, wear the gloves. Anytime you're coming in contact with the blood, where the acute check, wear the gloves. Milking of the finger is good. Take the blood from the side. And first blood, remember, wipe it, the first blood, before you take it for your acute check. So I'm giving you some instruction. It's all up to you how you will read it and how you will be ready for your test. Next is, you tell the patient, you squeeze it, place the blood, where it says place the blood, remember, wipe the first blood. An emergency question, everyone should know CPR questions are, but very first thing I want you to remember, before patient is unresponsive and you're going to start CPR. Before you start CPR, what is the first thing is? What is the first thing we do? Shout or gently shake your patient. Are you okay? A lot of time we miss that. And what do? We say open the airway and start the CPR. So please read your question. So first thing is you shake the patient, then you open the airway, and then what the pulse we are checking at the last, carotid pulse. And you do the CPR. And compression, everyone should know, where do you keep the hand, is on the sternum, on the middle, and place the heel of your second hand on the top. So make sure we all know about your little bit on CPR questions are. Compression, how far do you go? 1 to 1.5 or 2 inches. And you are pressing where? On the sternum. 1% you have CPR, 2% CPR, 30 compression, and rate for 100 per minute. And after 2 cycles, you reevaluate. 2%, 100 per minute, 2%. Infant CPR, what artery you are checking in infant? Underline the word number D, brachial artery. In the babies, we check the brachial artery. And make sure we all know the infant CPR, encircle the hand compression with thumb and lower half of the sternum. And then you're using both hands to press and compress. So some of your CPR, if you know, good. If you don't, just review a little bit on that. Infant body finger or foreign body obstruction. In infant foreign body obstruction is back blow. Is good. Highlight that one. And then what do we have here is deliver in the third line 5 back blow between the infants. And also in the C section where it says C at the end, never use blind finger. That means never use the blind finger to clean them, and that also you avoid in your answer. Number 7, for adult, when they are not breathing, what do we do? Is abdominal thrust, which is on second line. Heimlich maneuver. In adult, unconscious patient, down face, the face would be up in unconscious patient, and then you move on, is perform the finger sweep and press the abdomen and also upward thrust. Infiltration, phlebitis, we already talked about it, and shock. I will move on. So IV infiltration, we already said phlebitis is inflammation. IV infiltration means the IV is going into the vein. Now I will move on to shock question. What are the types of shock we have? We all know shock. We all know the Trendelenburg position. But remember, is allergic shock. Patient is going allergy reaction, airway, and what do you monitor for them is anaphylactic, allergies, airway. What do you give them here? Epinephrine. And Benadryl you can give. Breathing problem, you can give albuterol. Bee sting question, what is the priority? I said airway. So keep that for your airway question. Next is, you have cardiogenic shock. Shock is not only one type of shock. Patient has cardiac problem. Patient is going in what? Cardiogenic shock. When patient has MI, myocardial infarction, patient is going in shock. And low blood pressure, same symptom, tachycardia and tachypnea. Cardiogenic shock. Neurogenic shock. Maybe neurogenic means a spinal anesthesia, anything in the brain. Number 5. What is septic? What is septic? Means infection. Patient has urosepsis. Patient is having bad infection. That bad infection leading patient into what? Shock. Okay? Leading into what? Shock. I think please stop talking. This last 3 lines, continuously some of you people are talking there and disturbing. So don't talk. If you don't care, that's fine, but don't talk because you're not disturbing yourself, you're disturbing the other people. Is number 5 is septic shock. Septic means bad infection. Bad infection lead to is patient turn into shock. So what do you treat first? If you have a septic shock, yeah, you're monitoring patient, but you got to treat the infection. Psychogenic, emotionally, stimulation, and that lead to shock. Number 7, bleeding. I already talked about direct pressure. If you have femoral area, thigh area, groin area, you monitor for bleeding. Radial, we talked about in the lower. Brachial, we talked about the upper arm. Carotid is in the neck. Any bleeding question, I said direct pressure. In the second line, indirect pressure. What is indirect pressure is the artery you're applying the pressure, or tourniquet. That's why we have tourniquet for amputation patient. Epistaxis word, nose bleeding. Yes, one could be any spray, humidity can cause, but what is common cause of epistaxis? Hypertension. Second line. Patient is having nose bleeding, what do you do first thing? Assess the blood pressure. Apply the pressure. How long do you apply the pressure to stop bleeding? 10 to 15 minutes. Internal bleeding question. There's something wrong in the system. Patient has internal bleeding. And what is hemoptysis means? Coming from the sputum. Expectorate word. What is the reason for hemoptysis are? If they ask you, patient is admitted, patient has hemoptysis, what are you assessing your patient here? What are you assessing? Respiratory problem. What is the respiratory maybe in the lungs? What are the reasons for hemoptysis, lung cancer, TB? And that's what you're assessing. Hematemesis, patient is admitted with vomiting blood. What are you assessing? GI system. What are the reasons for hematemesis is ulcer and liver cirrhosis. So remember, two answers there. Melena, same thing, melena. The blood is in the stool. And what is melena could be again? GI. Maybe ulcer patients are duodenal ulcer. Maybe patient has liver cirrhosis and the blood is going in the stool. Hematuria is the blood in the urine. What is the reason for hematuria? UTI. And painless blood is what? Bladder cancer. What is the reason for bladder cancer? Is smoking. Write down on the side. Abrasion question, we said clean the wound, very important. What else do you ask your patient if they have tetanus shot? Which else patient do you ask for tetanus shot? Your burn patient. Burn and open wound, always ask if they have tetanus vaccination. If they didn't have, every 10 years the booster dose you give or the tetanus shot. Next page, the word is thrombocytopenia. What is thrombocytopenia? We talked earlier, low platelet count. Make sure we all know the platelet count. And patient has an 100,000 low. And what do you monitor? Purpura word. If you have purpura, that means on the skin. Thrombocytopenia or purpuric hemorrhage. What do you monitor here? Is the bleeding. And where is the bleeding? And monitor for petechial and ecchymosis word. And patient has thrombocytopenia purpura. Purpura, you're looking for skin. And what are you looking on the skin? Underline the word ecchymosis. Underline the word you're monitoring for patient for the skin and petechia. And what do you give them for your patient when they have thrombocytopenia purpura? Could be immune system, immunoglobulin. And what do you prevent them? Is from any injury, gentle handling, and also monitor for bleeding. The next word, you have cells and mitochondria that they give you the energy. Now I'm going to move on your job description question. And UAP, we already said what is UAP? Unassisted personnel. And what do you monitor before you assign anybody to do the job? Number one is evaluate, assess, and teach. Very important, those three wordings are. Second line, before you give anybody assignment, verify to see if they can do the job. You may have some good CNA, some can follow through very good, but make sure you assess. I want you to highlight the word MA. UAP you guys already know. What is MA? Is medication aid. Medication aid. Now they're making people to pass medication. They worked as a nurse's aide or CNA and they don't even have LVN license. And they're training them and they're replacing LVN. And they're having them to pass the medication. So if they give you a question, you have a medication aid, and medication aid becomes sick, and she's going home. What would you do when she's going home? That means you call your supervisor, you call administrator, or you take it over. You take it over. You don't need to call anybody. Why? Because they are replacing you, they are going home, you are there, you complete the medication passed. Everyone is okay, UAP, an assistant CNA, that means they're not trained. UAP word is an assistant that untrained, assistant personnel. MA means is medication aid. Medication is passing medication. LVN will finish the medication. And which patient do you assign your UAP and CNA? Remember, stable patient. variable blood pressure, high blood pressure, they cannot check. Patient who has dysphagia, don't assign them for feeding because they're not stable. Delegate and ensure UAP can explain and understand the procedure. So you guys are going to get a lot of questions on your assignment and your job description. And next is UAP, teach them how to remove the gown if your patient has IV. How do you remove the gown? A patient is having on this side IV on the right hand. First you remove the left side because then it becomes easier and you can pull it out on the other side. So remove the gown unaffected side. UAP restriction, what you cannot give them. No skills, anything, no assessment, no evaluation, no sterile technique. You can highlight those words. And triage, they cannot do that. They can assist you, but triage means you have an emergency and you're doing a patient assessment. UAP cannot do it. Okay for UAP is same as CNA, bathing, hygiene, feeding, ambulation, vital sign, assisting maintaining the safe environment, and drain catheter. They can empty the bag. Task consideration work. When you're giving task is considered in mind if they ask you. What is important when you're assigning your patient here? Line 2 in task consideration. Be performed with predictable outcome. That's important. Whatever you are giving, what is your predictable outcome? Can they follow through? Can they do your job? Are we clear? So very good answer here. Perform with predictable outcome. UAP. Can you give UAP? Underline the word three-way catheter. Irrigation. Can you give irrigation patient order? Can you give them? Yes. They're not doing irrigation. What are they doing? Patient care. Can they do the patient care? Yes. But they use the word patient has three-way irrigation. Can you assign them? Yes. Please highlight that and make sure you know. 3 irrigation, they're not doing irrigation. And wound assessment, no. Any wound dressing comes out, that's okay. But putting back the dressing should be LVN and RN. G2 feeding patient. Yes, they're not doing feeding. They're taking care of the patient, but they make your question look. Can you assign? How many patients we have G2 and we are CNA doing the patient care? Yes. So you can assign them G2 feeding, same UAP patient you can assign them. I want you to write down on the side, pacemaker patient. Can you assign them? Yes, for UAP. Can you assign them after seizure? Yes. Can you assign them after tonsillectomy patient? Yes, they had already the surgery and they're sleeping. What do you monitor? Teach them. Hip fracture patient, can you assign them? Yes, but what do you teach them? Use the pillow between the legs. So everyone, three-way catheter, G-tube is okay, and G2 patient, they can do the patient care. And can they follow pacemaker? Once they have a new pacemaker, patient is okay. They can take care of the patient. Hip surgery patient is okay, and you give them. Patient finished seizure, can they monitor your patient? Yes. So few things, lot of questions you will have so close on your assignment and for your job description. I'm going to go nursing practice. Nurses practical aid, that means LVN. And what would be, you are looking as LVN job descriptions are in your question. And we all know what you can do it. Number 1, do you keep your active license? When you get your license, do you keep your license active? Yes. Your license must be updated. If your license expired today, can you work next day?
No.
No. So remember, your question for your license, number 1. What is in license? If you have expired license and nobody noticed and you're working, is that legal or ethical? No. So license is very important. So where it says PN, able to assist an assessment on admission. LVN is assisting RN for completing assessment. You're doing mostly all the work. And RN is signing. So aren't you helping RN? Now your questions are, yes, who do the assessment? RN. But LPN, what do? We assist. We did the body assessment. You signed it and RN is going to also sign it. So you are helping on admission with assessment. Helping. Next line is, I want you to highlight the word advocate. Who we are for our patient, advocate. Patient cannot understand and patient cannot do who you are protecting your patient. So remember in your question, who we are as a nurse, we are advocate for our patient. Patient cannot speak language. Find somebody who can speak and communicate with us. Patient has financial problem. Guide them with social workers. So your questions are going to be worded this way that you should be able to understand the word assessment, advocacy, and underline the word, what do you follow when you are practicing every day? PN scope of practice. Underline that. And what is your PN scope of practice is? Your cough, deep breathing exercise? Is it that in your scope of practice? Yes. And NPA 12-hour shift. Your shift is how many hours comes under Nursing Practice Act. So remember, your questions are going to be NPA. Everyone remember Nursing Practice Act. What do you follow? Nursing Practice Act. And what is your scope of practice? And underline the word narrative summary on each patient. When your patient is going home, what do you give them? Is narrative summary. And so their question, you're going home, what do you give your next nurse who is coming on? Summary. Narrative summary. You don't just walk out and say, here's my key and I'm leaving for home. We give the report. And what report is called narrative summary. PN scope of practice is defined under Nursing Practice Act. So remember the word Nursing Practice Act, the scope of practice, all your questions, those two words. Malpractice is not, how do you compare your malpractices? With the prudent nurse, means equal person who is qualified. If you haven't done, is the other nurse supposed to do it? Yes, that's your policy. And you didn't follow, that means it's your malpractice. So highlight that word is prudent nurse. Confidentiality. Not only pulling the curtain, talking about your patient, giving report about your patient in the hallway where everybody can listen. So remember, anything we are talking, any question, and you hear someone is talking in the hallway about a patient, or in a nurse's lounge, you are discussing about patient, what you shouldn't be, you must report it, or immediately we shouldn't be doing. I want you, another few things everyone should remember. If you are going to be, you guys have done leadership, right? So we are as working together, and we give example how you are working. And number one is in your leadership question, or you're working, what is important is conflict. What is the meaning conflict is? Resolve your conflict. Working with each other. Oh, I don't like that nurse. I don't really care when she comes on to work. Who cares who's coming on? But what is it important here is don't keep any conflict. Why? It interferes with your job. So when you're working there, we are there for our patient. So what do you remove in your job is conflict. Next line, you add there. These are not there. I'm giving you all the directions, some of your questions. So number one, no conflict in your question. Number two, documentation. What is the meaning? Documentation, whatever you do for your patient is, what is your documentation? Is it legal? Yes. Is it ethical? Yes. Ethical, right and wrong. Are you supposed to do your charting when you have done your job? Yes. So remember the word, your documentation is under what? Your legal and ethical. Whatever you do, you document. Patient is not improving. You need to document. You need to notify. And legal. License, revoked license. Can you practice revoked license? No. It's ethically wrong and is also legally wrong. How do you keep your license active and good? How do you continue keeping your license? You guys, when you will receive it, you must continue education. Attending the meetings. Any questions on that? So if they ask you, how do you keep your knowledge update with your license? Attending the care plan meeting, attending any meetings you're supposed to go. And before you continue your license to reactivate, you have to take certain continue education. I think about 30 hours, RN and LVN. We all have to have continue education before you will send your license. And you have no problem in your license. Nowadays, anything you do wrong, your license is revoked within no time. There are lots of people are sitting there for job. You have to be very disciplined. You have to do your job correctly. Don't walk in, don't clock in anybody's car, don't leave the building without knowing your break time and not break time. You go on smoking 15 times, that's not your break time. So remember, all these things are monitored when you have a license. Lying, falsifying, signing somebody, clocking out, signing wrong medication. You have not given medication. That's all falsification. And all the DONs are responsible to call the board and notify anything you do wrong. That's their responsibility. Nobody's going to put up you do anything wrong. You come in the building, clock in, you take a car, you go buy your lunch. You're not in the building, you are fired on the right on the spot. You walk in to take your assignment and you tell your patient, I'm too tired, I don't think so, I like this assignment, and I'm walking out. You walk out, you're self-terminating. So remember, a license, you are earning with such a hardship, working, paying fees, and after that, we have a lot of legality. So remember, continue education, renewing, keeping your license active, be honest, be truthful, signing in, out, charting, everything is legality. Family notification. Another question maybe. Patient is mental health. Patient is improving. What is your job? Your questions are not going to be list your responsibility. Your questions will be all open answers and you have to pick up the best answer. So remember, another answer can be, your patient is improving, family notification. Condition is improving or condition is not improving, are we supposed to notify the family member? Yes, okay? So please remember some of the things. Last thing is respecting the culture. We all are different culture. And I'll tell you, in NCLEX exam, you have to memorize all the culture. Because all the food they're asking, what they do when they're born, what do they do when they die. Not only knowing we respect. You remember the one word you guys have learned in culture? Ethocentrism. Remember that wording? Ethocentrism. What is the word that? And that may be in your question. Ethocentrism. What is ethocentrism? My culture is the best. Right? That's not good. All cultures are good. Respect everybody. As a patient, as a co-worker, as your friends. Ethocentrism means self-centered. We respect only, I am the best. My culture is best. No, we all are good. We respect each other. So in your question, ethocentrism, culture, following up, and very important, remember you guys have done the question, and in that, there was one thing is how do you do your assessment for your patient R? Number one is by labs. That's why labs are important. So in your assessment question, what do you do when you're charting or assessing? Remember, is you look at the lab. If patient labs are improving, your physical therapist knows, your respiratory therapist knows, your doctors know. So remember, these are important when you're assessing and documenting. Not only head-to-toe assessment, what would you be documenting in your chart? They're asking you. Your labs, you look in there. When do you look your labs? As soon as you go to work, your labs are there. Early in the morning, first thing you call the doctor and report your abnormal lab. Those are going to be on your question. So remember, you guys all LVN, you can give your medication for your patients, vital sign, documentation, and you're reporting to the doctors. You're doing the dressing, you're giving enemas, you're doing the treatment, and you're replacing if you have medical or medication aid. I will move on, nutritional assessment. I just gave here, you guys can read through your iron, your food in the last box, vitamin A, vitamin C is good for the patient's wound care. Next page, we already talked about the calcium. And everyone remember the normal calcium, and you guys have diet on calcium. What is low calcium causes? Where do we get calcium? Parathyroid gland, low calcium. What are we monitoring with low calcium? Are the muscles. Then you think about the fractures. And what food is good in last two lines? You have not all the time milk and cheese. We all know milk and cheese. Collard greens. And you have is that you won't think, a spinach, they can throw that. And green beans are there for your calcium. Potassium, what is potassium is affecting? Remember, the heart. What did I say? Potassium affects where? The heart. And what would you monitor? Cardiac. If you have too much of potassium, monitor the heart. Sodium. Sodium is not good for your swelling, edema. And remember, I said two wording, ascites. Remember the word ascites question? There is a fluid. What do you cut down? Ascites and edema, sodium and water. And in the end, you have sodium. In your question, ketchup and ice chips. You give them, underline the word hyponatremia. When you have low sodium, very important question, cut down the fluid. And what is the meaning is here, you give only ice chips. Hypernatremia, they can drink water, is okay. Hyponatremia means the body is retaining more fluid. And this hyponatremia goes in patient with, when I talked about ADH, antidiuretic hormone. So very important, sodium, potassium, calcium. Before I move to the next thing, patient has NG tube suction. What do you monitor patient who has NG tube suction? What is the meaning suction? They're removing the fluid. What are you going to monitor? And what would be low? And you may have question and answer is sodium would be low. Why? Because you're removing the fluid. Patient is vomiting. Patient, you're removing the fluid. Patient has fistula. What do you monitor? Low sodium and low potassium. Everyone is okay? So please add that there. And next is vital sign. Everyone, we all should know which patient you will have increase the blood pressure. You're increasing the blood pressure, underline the word CHF, renal failure. Low blood pressure, patient is bleeding, and postural changes. We already talked about that, apical pulse we talked about. The last thing is here your vital sign. And I said yesterday, in the peds, very important, 30 to 60 pulse rate. And I said where? Maybe in 6-month-old baby. So infant vital sign, we all should know. And neonate babies, toddler, at least you should know. Everyone, at the last, I want to add one more thing, is the stages of grieving process. What is the stages of grieving process? The wording is death and dying. What is in death and dying? We have the first stage. Remember the word dabda? Denial, anger, bargain, depression, and the last one is what? Acceptance. So any question, person is going in the grieving process, we all have done. But now we are putting all together. The last thing I want to give you the answers. After 100, we did 100 yesterday. Yes. So before we go home, I wanted to give you. And please study good, make sure we all do good. Okay? And so I did 100. Everybody has your package? Okay, I will give only the answers. Otherwise, we'll be staying here for another hour or maybe more. So there are some questions when I will read the priority, write down on the side because they're saying which number comes first, okay? So everyone has till 100 and I said 100, answer was number 2. Okay. Are we okay? Everybody has your package? Okay. All right. 101 is number 3. 101, number 3. 102 is 2. 103 is 3. 104 is 3. 105 is 4. 106, 1. 107, 4. 108, 3. 109, 3. 110 is 3. 111, 4. 12, 112, 4. 113, 1. 14, 3. 115, 1. 116, 4. 117, 1. 118 is 3. 119, 3. 120, 2. 121 is calculation and say is 2 tablets. So just add it and look some of your calculation. 122 is 3. 122, 3. 123, 4. 124 is 3. 125, 4. 126, 3. 127, 1. 128, 2. 129, 2. 130, 1. 131, 3. 132, 4. 133, 3. 134, 3. 135, 3. 136, 4. 137, 2. 38, 1. 139, 2. 140, 1. 141, 1. 142, 4. 143, 3. 144, 3. 145, 4. 146, 4. 147, 4. 148, 2. 149, 3. 150, 2. 151, 1. 152, 3. 153, 4. 154, 3. 155, 1. 156, you have priority. So write down on the side, number 2 comes first, then 3, then 4, and 1. I'll repeat here. 2, 3, 4, and 1. 157, 2. 158, 2. 159, 4. 160, 2. 161, 4. 162, 1. 163, you have 1 answer, 2 and 3. 164 is 3.
Say number 163 again.
163, you have 1, 2, and 3. 3 answers, 1, 2, and 3. 164 is 3. 165, 4. 166, 3. 167, 1. 168, 2. 169, you go 4, answer. 170, 3. 171, 1. 172, 3. 173, 4. 174 is 4. 175, 4. 176, 2. 177, 4. 178, you have 4 answer. 179, we have 2. And 180, you have to do INO. The total is 870. 870. 181, 2. 182, 3. 183, you have 3 answers. 1, 2, and 3. 1, 2, and 3. 184 is 1. 185 is 2. 186 is 3. 187, you have 2. 188 is 3. 189, 3. 190, you have 1. Then you have 3 and 4. 1, 3, and 4. 191 is 3. 192 is 2. 193 is 2. 194, 2. 195, 2. 196, 3. 197, answer is 620. 620. That's output. 198, number 4. 199 is 1. 200, your answer is 0.7 cc or ml. 0.7 ml. 201, 2 answer. 202 is 4. 203, 2. 204 is 1 and 3. 205 is 3. 206, 1. 207, 4. 208, 2. 208, 2. 209, 2. 10 is 3. 11, 211, you have 4 answers. 1, 2, 3, and 4. 1, 2, 3, and 4. 212, 1. 213 is a priority question. So you write down on the side. The first answer is 4, then you have 3, then you have 2, then you have 1. 4, 3, 2, 1. So you write down on the side, then read it and see the priority, which one you will do first. So 4, 3, 2, 1. 214, answer is 2. 215, answer is 2. 216, answer is 3. Next is your priority, 217. They have a lot of numbers, but which one comes first is 6. Then next is 5. Then 2. Then 4. Then 3 and 1. Let me repeat. 6, 5, 2, 4, 3, 1. You got to go the priority. Which one do you first do? 6, then you do 5, then you do 2, then you do 4, then you 3, 1. So if you're doing procedure, they're saying, how do you put in order? Are we clear? That's the priority. 218, you have answer 1, 3, and 4. 219, you have 3 answer. 220, 1. 221, 1. 222, the last one, you have number 4. All right, so we got answer. Anybody is missing, you can come back. Anybody else's, you guys can go home, make sure we sign out, and good luck.
Thank you.